Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today our topic of discussion is about infections in corneal grafts, patients undergoing corneal transplantation and they developing infections. How these patients can be evaluated, what are the possible causes and the possible management. When we talk about the possible causes of infection in corneal transplant patients, corneal sutures is a very important issue. Sutures in human bodies are foreign bodies. In corneal transplants, when they get weak with the passage of time, they get broken up, loosened, exposed, they do cheese wiring. So what happens that they provide an ideal place for microorganisms to grow. And we know that usually Staph aureus and streptococcal are causing leading cause of corneal infections in corneal transplants. So these are the foreign bodies. Considering this aspect, many surgeons believe to go for suture removal once they feel that the graft is developed enough strength over there, it is holding its place, and they can go for, depending upon the situation, 12 to 18 months duration, they can remove these sutures. Second thing is very important, that use of topical steroids. We have to give the steroid eye drops to control graft rejection for a long time. And it is considered that these topical steroids, eye drops, can decrease the local immunosuppression of the area. But this is again debatable, because with the passage of time, the drops have been tapered off to such a minimal dosage and strength that it is unlikely to decrease immunosuppression and cause potential infection. But these things are in literature which are possible causes for the eye infection. The other thing is, when we talk from the patient aspect, that is his ocular surface. If the patient has got recurrent history of corneal epithelial defects, dry eyes, he has eyelids problem, dry eyes, trichiasis, misdirected eyelashes, all these things from the patient side can also contribute to the repeated infections. Apart from this, it is also very important to know how the graft was preserved, which storage media was used, the time duration, handling, and the technique of preservation of that material, that graft which was transplanted. These are also very important. Once these patients come to us, we start our treatment, proper examination, vision, all things, and we do documentation, anterior segment photographs. But very important in this thing is to rule out the infection deep inside the eye. Usually, corneal infections in these grafts remain anteriorly because of the natural barriers. Suspensory ligaments are a natural barrier which prevent the penetration of infection deep down into the eye. But we have to do ultrasound to rule out endophthalmitis. Very important. The second thing, if we have got the facilities available as shown here, OCT anterior segment is a very good way to quantitatively find out the penetration and extent of infection inside the cornea, which can also be done, which is particularly very helpful in fungal infections. So all these things once done, And it is a well-established case of corneal infection, as shown in this photograph. We have seen earlier, it is a big abscess and not yet hypopion over there, and over there ciliary congestion, decreased vision, all these things. So we have to start him on fortified aggressive antibiotic therapy. We can use fortified vancomycin, ceftazidime, but before that, very important to do culture and sensitivity. Gram staining, ginger staining, all the routine culture media is very important to do it before taking the samples. And once we get the report, the antibiotic drops can be tapered and can be used according to that. So this is a very challenging case, and it can happen and it can present to us in our clinics. That patient has undergone corneal transplant and now he has developed these infections. When we talk about the management, medical management always starts with culture and sensitivity, gram staining. We have to send all these things. Scrapping should be done deep from the base of the corneal ulcer. All this material for gram staining, ginger staining, and culture plates, they should be sent to the laboratory microbiology section. And until the report comes, the fortified antibiotics, aggressive, can be started. And once the report comes, we can change it accordingly. Once the infection gets under control, these patients usually develop opacities, and this opacity can be later on managed with the new corneal graft once everything is settled down and it is free from any infection. But sometimes we cannot control infection. The infection continues to grow over there. It is aggressive. It is involving deeper down into the cornea and involving further in the cornea, and there are chances of developing endophthalmitis over there. Then we have to remove this corneal graft, and we have to send this whole corneal graft along with the suture to the microbiology section to study. And we have to put a therapeutic keratoplasty to save the eyeball. As I always say, that our first target is to save eyeball and then to think about the vision. So this was a case which I wanted to discuss with my respected audience, that in spite of doing wonderful surgery, everything is perfect, one day these patients can present to our clinic with such infection. And the reasons may be multiple reasons, as I discussed. They may be patient related, they may be graft related, and they may be possibility because of the technique. So all these things can happen over there. So I hope my today's presentation will be beneficial to my respected audience in their clinical practice. I want to thank you for your attendance and attention. Thank you.